Welcome everyone to COVID Conversations hosted by Dr. Jason Diaz. We're very excited to welcome Dr. Diaz back to continue this very important conversation about vaccine shaming. Dr. Diaz has earned his PhD in cell and molecular biology from the University of Pennsylvania with a focus on virology. He is currently an assistant professor at LaSalle University in the Integrated Science, Business, and Technology program, which sounds awesome. So thank you so much for being here, Jason, and I will turn things over to you.
Thank you. Yeah, and I'm really excited to be back after my first kind of conversation with you all at the end of, I guess that was literally a month ago from today. It was February 25th. Um, we thought that maybe we can do an extended conversation over the next couple months as things evolve. And so my vision kind of moving forward is I'm going to spend maybe 10 minutes going through some prepared slides that kind of give you like just some small updates on kind of more recent things that have happened in the arena of the COVID vaccines. I have a prepared kind of ethical question we can kind of talk about and think through. But this session is also meant to be kind of a space for folks to just ask whatever's on their mind. And actually, because of that, I want to invite everyone who's here now in the chat, and you can either do this publicly or if you want to private message me, that's also fine. If you already know coming into today's talk that you have one or two questions that you want to ask, please put them in there now so I can get a sense of kind of where things might go, so I can kind of make sure that I'm allotting enough time for all of that. But there'll definitely be time for just open-ended questions a little bit later. So at any time, put your questions in there. I'm going to share my PowerPoint slide, which briefly you'll be scared to see there's 74 slides. That's because this is a master PowerPoint. Just in case if questions come up, if I have prepared slides to demonstrate something, I will do that. I'm only planning on doing maybe 15 of those right now. So we'll see how things go. All right, so thanks again for that introduction. Today's, I think, focus is going to be about vaccine shaming. Before we do that, just a couple of slides about kind of where we are. But even before we do that, I want to invite us all to be present in this space together. I was just coming in from class. I'm sure you're all coming in from other meetings and things like that. And I want to also, before I forget, thank my colleagues, Dr. Kelly Daly and Dr. Kristen Rexing. Dr. Daly is in the communication department and is an expert on vaccine messaging and hesitancy. And Dr. Rexing is in the public health department, an expert on policy and things of that sort. And my collaboration with them this past year, thinking through LaSalle's even kind of COVID planning, has really given me a lot more tools and framework to have the types of conversations that we're having today. So I wanted to thank them. And as we come into the space together, I want us to think about who we are, where we bring into the space. So what are my unique fears and concerns? What are my beliefs and values on this type of question about the pandemic? What have been my experiences that I'm bringing to this? And then take a moment to then also consider who else is in this room with me and how are their values, their experiences, their perspectives different, and how can we then come together in this space to kind of think through this global moment and think about how we can come together as a community to support one another in what continues to be a difficult moment for us, but I think has windows of hope for it finally kind of turning the corner and getting to a better spot. So I just want us to again be mindful of what we're bringing here to this space, as well as what others are bringing to the space and how we can come together in community. So again, you've already heard my introduction. My degree is in cell molecular biology with a focus on virology. In the various realms of being a professor, I count myself a science educator first and foremost, and researcher kind of underneath that. And some of what I'll be bringing to my thoughts today come from my experience of being part of an immigrant family and thinking about the communities who have experienced maybe even the healthcare system and just health in general a little bit different than maybe others who might be on the call. So first, some small technical updates. And I had to update this again, even just last night with some announcements from AstraZeneca. So this is, I'm sure it's already out of date, but we'll just do our best, okay? And so you may remember this from last time if you joined me in February, although now there's a new column for AstraZeneca. Currently, we have 3 really exciting vaccines that have been granted emergency use authorization by the FDA, which means they can go into people, basically. And the AstraZeneca one has been approved in other countries already, including Canada and the UK, and is in the process of being reviewed by the FDA. I anticipate that it will be granted emergency use authorization in the next couple of weeks. From a technology standpoint, I'm a nerd, and I love that actually these are 2 sets of very cool new technologies for vaccines that haven't had a big platform up until now. And if that interests you, I can talk more about how they work. But in general, I will say that all 4 of these vaccines are reasons for us to be celebrating. They are all extremely effective. Even that kind of somewhat potentially worrying 66% or so for J&J is actually very good considering the context that that data had been generated in. And also I will note some of the context for that, because one of the things, so one of my kind of, I want to say pet peeves, so something that I really want to make sure people understand is that there's, I think, undue concern over the J&J is a worse vaccine than the other 2, which I think is not necessarily true for a couple of reasons. One of which I just want to emphasize is that number, that 66% number, is within, I think, 28 days of the shot. But in the clinical data that was submitted to the FDA, you can actually see over time it continues to rise well after that, so that by, we'll say, day 60 or so, it's much more to like an 80-85% efficacy. So I think that the J&J vaccine, I count from my perspective, is just as good as the others, and from a public health standpoint is actually a huge win because it's way easier to distribute. So I'm happy to talk more about some of the specifics on this, but I think in my mind they're all equivalent from a public health standpoint. Everyone should be happy to get any of these vaccines, and they're all going to do a lot of good. And happy to talk more about the technology and the clinical data if that interests you. I want to just remind folks that at this point, the major, side effects for the vaccines are very mild and treatable. The COVID ones are also treatable in large cases, but are also a lot scarier and a lot of unknown long-term effects. There are, of course, some very, very rare cases of more serious side effects. So with the mRNA vaccines in particular, some reportings of serious allergic reactions for some folks, which we think might have to do with some of the lipids that are used in that vaccine. That hasn't been proven yet, but that's kind of the hypothesis right now. The rates are very low. It's like 11, I think it's 11 people per like 100 million or something like that. So extremely unlikely that you may experience that. And if you do, it's a very straightforward response. And this is actually why you have to sit for 15 to 20 minutes after getting the vaccine, is to make sure that you're going to be okay. In the last couple of weeks, there's been stories about this blood clotting thing with the AstraZeneca vaccine. Again, the numbers don't really bear out a causative story that's really easy to there doesn't really seem to be, I think, an increased risk of blood clots due to this vaccine. I think sometimes when multiple of the same event happen in a short period of time or in a particular population, it makes us sit up and pause for a moment, and that's what happened. But no real concern at this point that this is a major concern for those vaccines yet. And I haven't seen any similar kind of weird stories coming for the J&J vaccine. But we'll just see what happens. Again, I think these vaccines are very safe and very effective. And I think that there's been a lot of excitement actually over getting the vaccine. That's kind of borne out in how people are trying to go get their vaccine shots, right? And getting maybe a little impatient about that. And so this is a topic I want to thank Angela for proposing this, because this is a topic that I think a lot of people are talking about and experiencing, right? And what I mean by vaccine shaming here is the fact that depending on how savvy you are and what connections you have and just kind of what information resources you have available, some people are having an easier time getting vaccine appointments than others. And how should we feel about that? So I just have a couple of, so as we kind of think about this question, and I'll give us a moment to kind of think about this together out loud, but I want to set the stage for this conversation a little bit, just to remind folks that um, by and large, the strategy of this country up until very recently has been a decentralized one for this pandemic, where the CDC is providing some guidance, perhaps, on how to prioritize. But the federal government, up until recently, hasn't really taken a very active role in addressing this. This has changed under the Biden administration, and we're just now starting to get our stride. But it's still, it's been a bit of a struggle up until now. And so we've really left it up until this point for the states and local public health offices to figure it out. And even with that influx of more federal support, that first initial period in December into January and all of last year has really set the foundation of kind of like how well we're set up to serve our communities. And so this means that, of course, depending on where you are, depending on how resourced your public health agencies are and how connected they are to different possible distributors in the community, different people are having different experiences, even within the same state, sometimes even within the same city, right? So that decentralized strategy or lack of strategy also means then that there are actually multiple ways that people are finding themselves getting into the line, right? And so of course the public health offices are saying this is who is eligible, but they're not necessarily saying go to this one single site. At least not in Pennsylvania. That's not really happening to a large extent. And so it's like, this is who's eligible, and then you can go figure it out, right? And maybe we have a system for helping you find a site, but there isn't this one central location. So people are trying to find appointments through CVS and Rite Aid, or through their employer in some cases, especially if your employer happens to be a health center or a hospital. And then there's also these grassroots organizations like the Black Doctors Consortium. And up until very recently, actually even including recently, most of these systems are really relying on web-based systems for signing people up, alerting people of when appointments are available and where they're available, and also tracking for follow-up. And that is not a neutral decision, that it's very much web-based, right? Thinking about especially some of the populations that are most vulnerable, including our elderly and communities of color, who unfortunately experience a higher rate of poverty and lack of resources. The very people who are, I think, most at risk of poor outcomes with COVID are also the ones who are probably going to have a harder time on average, connecting to these web-based platforms for actually getting vaccinated, right? And also most of these forms are going to rely on the honor system, right? So most of them are going to ask you about, do you have underlying health conditions, and they'll probably list out what those are, and you can check things off. But by and large, these systems are not going to be asking you to verify, using, like documentation that you actually have these particular conditions. That again it depends on where you go, but by and large, we're going on the honor system. So I set this all up just to make the case that the system itself is unfair currently, in that it is very decentralized and relying on us to opt in. And so because of that, people are going to opt in different ways, and in ways that may make us, from a big picture standpoint, be kind of uncertain about what our ethical duty is here. That being said, the other way I want to think about this is, at least for the mRNA vaccines, which are stored, frozen, thawed, and have to be administered pretty quickly, if you want to maximize those doses, you have the issue where once at least the mRNA vaccines are thawed, you have to use them very quickly, within a couple of hours, otherwise the doses go bad. And various logistic problems that have been cropping up, like cancellations or other things, have made it frequently the case that you have a vial with 4 or 5 doses left that you had plans to administer, but for a variety of reasons that didn't happen, and you don't want those doses to go bad because we're in this situation where we want to vaccinate as quickly as possible. So what do you do here? How do you make giving those last 4 or 5 doses fair and equitable? The last thing I just want to remind people is there will be enough vaccine for everyone, at least in this country. Globally is a different conversation. And we will eventually get there for the globe, but currently we're not there yet. But for this country, there are plans in place. We will have enough. The question is not, will you get a vaccine, but when? And so these are all just kind of the different ways that I'm thinking about this question. So to kind of ground this a little bit more concretely, I want to talk about kind of where I am personally, right? So I am about 35 years old. I'm a Latino male, so I'm in that population of, on average, people who might have less access, although me personally, I don't fit that. I am a college professor. I have resources, so I am not within that kind of average group of people of color in that perspective, right? I do work at a residential university where there are students on campus in a limited capacity at this point, but we're hoping to get capacity back up, right? And so I do want to think about, there's a high chance of community spread for sure. I am fortunate in that I don't have any underlying health conditions that would make COVID more risky. And so I'm lucky in a lot of ways, right? And I live in New Jersey, which means I have the fun job of looking at both the New Jersey and Philadelphia guidance because both of those are relevant to me. And in both cases, as a college teacher, not a K through 12 teacher, I am not eligible in either location yet, although hopefully in the next month or two. I'm also on a personal level, I am lucky in that people who are very close to me are either already fully vaccinated or in the middle of getting their vaccines. Actually, my husband's getting his second shot tomorrow. So from a personal standpoint, I'm feeling very jealous and envious, right? Because I want to join the party. I want to make sure I'm vaccinated so that on Mother's Day, I can go give a hug to my mom, who I haven't seen, since like last year, right? Like these are very personal, selfish, but I think reasonable things that I really want for myself, right? And so things I'm thinking about is, to be honest, from a risk perspective, I can wait. I've been able to stay safe until this point. And now that people close to me are getting vaccinated, my risk of exposure through close contact from those people is also reduced. So I really can wait from a health perspective. And I do believe, and I do think that there are people out there who quote unquote deserve or should get vaccinated before me, right? But if I did have the opportunity to get a vaccine, is it my duty to say, you know what? No, I really don't like the way that the rollout is going. I really want, incarcerated people to get vaccinated before me. So I'm not going to take advantage of it until much later. If I choose to do that, does that actually happen though? Where I don't actually get to decide where my dose goes, right? I either just go in to get vaccinated or the system chooses someone else to get the vaccine, right? So I actually have a very limited way to impact the system and the system's decision in who gets vaccinated when. So, in the next couple of weeks, I'm going to be able to, possibly find vaccines. I'm sure that if I ask some folks who have already been vaccinated or kind of in those systems, that they would be able to connect me to places where I can probably get at least my first shot. And, what should I do in this situation? So I want to turn it back to the people on the call just to ask kind of, not necessarily for you specifically, unless you want to share, just kind of like, what are your thoughts about this kind of problem where it's really on us to decide how we opt in, and there are ways that we can do that might take advantage of the system, and ways that we might do that don't, and what should we really do about this situation? So I'm just curious to hear what your thoughts are on this question. So I'm going to pause and invite you to either share something in chat. If you feel compelled to speak, but you're afraid of talking over someone, there's the participants button on the bottom of Zoom. If you click that, on the right-hand side, you'll see an option to raise your hand. So you can do that so I know to call on you. And the question I'm asking is kind of, what are your thoughts about this current situation where different people are having different access to the vaccine, and some people are taking advantage of that and some people aren't. Really, kind of, how do we feel about that?
I was speaking with a friend earlier today, and she was saying that in I guess in New York that she's eligible as a restaurant worker, but in New Jersey she isn't yet. And so her argument is, well, in some places, restaurant workers, I'm in an eligible category. Is it wrong for me to cross state lines? She's like, I technically lied and said I was a restaurant worker in New York. I'm a restaurant worker in New Jersey. And so I was talking to her and I'm like, well, you are at risk. But so what, like, in terms of ethics, in terms of crossing state lines, to do that, I was just having this conversation like an hour ago.
Sure. That's an interesting point. Before I respond to this, I don't know if anyone else wants to respond to that or add another question in here, and then I can maybe answer a couple of them at the same time. So what are other people thinking? Or are there any other stories similar to that that has you just thinking about this question?
I feel like I'm such a rules-oriented person. Like, my immediate reaction is like, but she's not a New York resident. Like, why would she cross state lines to like get it? She's like working in New Jersey. But I completely like see like her side of it and like understand the vulnerability she feels too. So it's really complicated.
Yeah, I'm glad that, so that's a perfect entry into I think what I wanted to say. So thank you, Emily and Natalie, for your kind of thoughts on that from two different directions there. So from a policy standpoint, what I will note is that the timing of when people become eligible in a given state are usually informed by how things are also opening up. So I don't know specifically. I'm not an expert. I don't track the policy necessarily on a day-to-day basis because I have enough on my mind. But my suspicion is that in New York, especially New York City, that they opened up indoor dining ahead of New Jersey. Like, I know New Jersey's actually been really slow on a lot of these things anyway. And so the fact that people are eligible as a restaurant worker in New York is likely informed by the fact that there's just the access for indoor dining is just now greater in New York than New Jersey, right? So there are reasons why like people are being eligible at different times. That being said, and I don't know if your friend goes to New York to work or she's just taking advantage of the fact that maybe she lives in North Jersey and New York City is just across the pond, so to speak. And even if it's the case that she just works and lives in New Jersey, right? She may be in a personal situation where even though New Jersey currently has reduced indoor dining capacity, her employer really is like squeezing all the juice out of that and really wanting people to come in as much as possible. And she feels unsafe about that, right? In which case, well, what's the ethics of that situation where your specific employer is within the letter of the law, but putting you in a situation that makes you feel at risk and you don't feel in a position to really push back against that? Now you're out as maybe trying to take advantage of this ethically gray area, right, of getting the vaccine. And I'm not an ethics professor, so I also just want to make it very clear at this conversation that my expertise is on technology, not ethics. So I just want to make sure I make that very clear before I kind of continue. But my perspective is that it's complicated, and I think what I have found is that oftentimes when I talk to people who are in situations like this, right, there are confounding factors that make everyone's situation a little bit complicated. That being said, I personally feel a little weird about, I would not want to necessarily lie on a form about something. Like, if I, like, one of the things that's been kind of interesting to me is like in New Jersey, one of the things is like if you're considered overweight or not. And like there's a specific like BMI index or whatever for that. And it's like, how close am I to that? Am I like really, really close? Do I kind of qualify there? Am I really going to like, so sometimes you get into interesting situations like that, but I'm not going to say like I have asthma if I don't have asthma, right? And so I will advocate for being as honest as you can, but I think people are kind of trying to bend the rules a little bit to kind of take advantage of opportunities that they may have, and I think that it's complicated, and I'll have a great answer for that. Well, I do have a couple answers that I will talk about in a moment, but at this moment, from an ethics standpoint, I don't have like she should do this or that. Just, sometimes it might be complicated. Let's see. Great. I just want to note that there's chatter in the chat box, which I will address some of those questions that came up early in a moment. But there's also sort of some cool stories of other efforts that people are taking to address some of this. So do keep an eye out there for anything that's interesting. We've had a couple of new people join the call. So I just want to invite those who just came in to join the conversation. Right now, we're just kind of talking about the phenomenon where it's really kind of on us to decide, like, how are we going to use these systems for getting our vaccine shots, right? There are guidance on who's eligible and who's not, but it's different per state and sometimes per county. And there's a lot of ability for us to maybe travel across county, city, even state lines to take advantage of different kind of guidances there. Should we be doing that? How should we be thinking about that? That's kind of the conversation that we're having right now. So does anyone want to add anything else to the conversation? I see Bob wants to talk. And Bob, I just want to note you're still muted. So I want to invite you to unmute yourself and share.
There you go. Can you hear me now?
Yes, thank you.
The issue about crossing state lines, if you think about it, states are a really lousy way to manage this process. Really, what you need to look at is metropolitan area.
Yes.
And as far as I'm concerned, North Jersey is in
New York City.
New York metropolitan area.
Mm-hmm.
And that's where you want to have the effect, and policy should be similar. And, the policy in South Jersey might be totally different, and it should be, but it isn't.
Yeah.
That policy about restaurant workers makes sense down here. It doesn't make sense up there at all. And that's an issue.
I agree. Mm-hmm.
To give you a similar example, a couple weeks ago in Philly, there were a couple dust-ups in the news. One was a complaint that Philly residents were being short-shifted on vaccines because so many people who lived outside the city, who worked in the city, were getting those vaccines because they all work at hospitals and medical facilities, right? And then, a week later, the suburban townships and counties were complaining that they were getting short-shifted because Philly was getting too much.
Right.
It's like, again, it's that metropolitan area. If they imagine it as an area, then it would make a difference. But
thank you, Bob. That was a very important set of kind of insights and just reminders of, what's actually important. And it's something I've been thinking about too, because again, I live in New Jersey, but I live in Trenton, so that my commute into Philadelphia is more reasonable, right? Or I live Trenton, larger area. And so it's seeing how Pennsylvania, New Jersey were in lockstep for a lot of reasons, but a lot of times New Jersey was a little bit more stringent than Pennsylvania. I'm not going to put any kind of whether I felt good or bad about that. That's just an observation, right? And so it was wild to me because I'm like, if I were to travel anywhere, it would be to go into Philadelphia for work, right? And so like really for me, I should be counting myself as a Philadelphian, but I don't live in Philadelphia either, right? And so I also wouldn't necessarily want to take away a shot that I think should go to a resident of Philadelphia either, right? Especially I don't work in a hospital either. So like there's no like I have not been vaccinated yet, just to be clear, right? And so I think, but your point is exactly right, where it really matters on where people are traveling to, and the metropolitan areas are kind of how we think about that. And so, and it's been very hard to do that because the structure of our government is very kind of fractured around these very specific ways that infectious disease just doesn't care about. And so it's complicated. So I think that's another really important aspect to that. So I just want to briefly scan the chat. If anyone else wants to jump in, please do that. Let's see. That's funny, I guess. Okay, so so here's something I just want. Again, I'm not an ethics scholar, so I'm not going to give you like a Ask Amy type situation of this is what I think you should do. But here's how I'm thinking about it. I really don't want to encourage people to be lying about things, partly because the vaccines are not so scarce that people should be resorting to this, right? I can imagine if it's a situation where like for some reason you really need the vaccine and this is your only way to get it, like you do you, but we're not in that situation. I'm going to argue. And if you want to do the kind of noble thing of saying, like, I don't need it right now, I'm going to let other people who need it better get vaccinated, just realize that you actually have no control over who gets vaccinated next, right? Because the system is set up in such a way that it's a little bit more murky, right? This third point is a little contentious because depending on where you are, whether this is true is a little bit complicated, right? But by and large, we have made an effort to really kind of serve those that are most vulnerable, at least from this respective age, I would argue, pretty well. Communities of color is a more complicated question where I don't think we've really hit the bar. I mean, we just saw in the I think it was in the Inquirer last week, maybe. I think it was the Inquirer about the Rite Aids, right, in Philadelphia, where like three-quarters of all the vaccines they've given has been to people who are Caucasian, and only a quarter to people of color, even though in Philadelphia it's at least a 50-50 mix of people of color and white and those who are white. And so on that point, there are still problems. But by and large, I think that we've done a relatively okay job trying to get those who are actually really at risk for serious disease, getting them at the head of the line. And because of that, right now, as we go into April, and especially as we go into May, we're now entering what I'm calling the gray zone of relative risk, right? So currently, I am a teacher, but I am a teacher in higher ed. I do not teach young children who developmentally really suffer from online learning. I was just complaining about some of the difficulties of online learning before the call started, but I'm working with adults. They are young adults, but they are adults, right? And so I totally understand why K through 12 teachers and staff are prioritized, because we really want those students to go back to class in person. But that is actually a decision to serve the students who aren't getting vaccinated, not as much the staff who are getting vaccinated, if that makes sense. Meaning, the risk of we know the risk of transmission from small children to adults is very low. So the risk that a third grade teacher has of getting COVID in her workplace is definitely lower than it would be for me to go back to college with a normal capacity, right? That's just how the numbers work. But she's being, prioritized over me because we're making a value judgment, and that we're going to value getting our kids back in school, right? And so because of that, we're in this gray area where the difference in value is going to be a little bit harder to kind of parse, I think, between people. So we're definitely now in an area where I think, if you can get vaccinated, just get vaccinated. So basically what I'm going to try and say at this point, because the benefit of you waiting is, on a public health standpoint, probably not going to be that much more than you just getting vaccinated yourself. That being said, if this makes you feel uncomfortable, or you still don't feel like you're having trouble participating in this, I'm going to argue, unfair system, there are ways that you can try to help, and that is to basically pay it forward, right? So there are organizations that are doing a great job of helping folks in need get the vaccines that they need. So I've already talked about them a lot. The Black Doctors Coalition or Consortium in Philadelphia is a great resource, and I'll show a slide about that. So if you want to donate or somehow support them and their work, that would be a great thing to do if you're feeling a little uncomfortable about getting vaccinated. Or if you know someone, like you have an elder in your family or in your social circle who you think may be having a hard time navigating the systems to actually get an appointment, reach out and help them get their vaccine, right? And also being kind of a champion for spreading good, reliable information so that people are really opting in. The last thing I just want to say is, the wave of people getting vaccinated are all the people who are excited to get vaccinated. So that's great. But we're going to be approaching in the next couple of months the phase where now there are going to be people who are a little bit more hesitant about the vaccine, and we need to push them to get vaccinated as much as possible if we're going to really kind of move the pandemic to a direction that we want to go. So I'm going to end on this slide actually, but I'm going to, wait, that's not what I wanted to do. I want to keep sharing, but minimize. Nope, that didn't work. There it goes. Oh, that didn't work anyway. Anyway, I'm going to put the link for the Black Doctors Consortium in the chat. That's probably the easiest thing, because I think that they are doing some really heroic and amazing work in the community, not just with testing and vaccinating, but also educating. And they are my go-to for if I want to support someone to make sure that people are getting vaccinated who need to get vaccinated. That's where I go. Okay, so there were a couple questions in the chat about other topics. I'm going to start transitioning there, but before I do that, did anyone have anything they wanted to add or just say kind of as I close this conversation about how we might think about getting vaccinated? What are some lingering thoughts that people are still having?
Do you think that, so currently it's, as you said, very decentralized, and with the change in administration, do you think there will be a push to centralize it? Because doing it, and what Bob said earlier about metropolitan areas, I'd never thought of that. That makes a lot of sense. So do you think there will be a push to not do it by state?
There we go. I think that for this first round of vaccinations, I'll talk about why I say first round in a moment. I think that we're going to kind of just inject money and resources as much as possible into the systems that have been put into place. Although I shouldn't say that, because actually, even in Pennsylvania, there's been adjustments even within the last couple of months with opening of these larger, vaccination sites and help from the National Guard and FEMA and things like that. So we're already kind of pushing towards that, but it's still, again, at the state level, not really at a national level. Given the way that the public health works in our country, where really the only national public health agency is the CDC, and then underneath that, it really is a state by state level. What I hope will happen is that there will be more support for assisting states setting up more centralized locations like arenas and convention centers and things like that, and giving them the logistical support that they need. So we may see some movement in that in the next couple of months, or we may just say, this is just what we have, and we're just going to try and make the best of it. That being said, there are those variants that are going around, right? And I think for now we're okay, but depending on how quickly vaccination goes, some of those variants of the COVID virus that seem to be able to dodge the immune system a little better, we may need boosters potentially next year, for example. So if it gets to the stage where we're thinking about a booster shot that allows you to get additional protection for a specific strain, which I would imagine if we're going to do that will be as early as next year. That second wave, I think, might either be more centralized or might be set up so that you can just go to your doctor's office and just get it done or something like that, and just have like maybe a national system. So we'll see what happens. I'm not a policy expert, so we'll see. Very good. Any other questions on this big question before I spend the last 15 minutes answering some user questions here? I shouldn't say user, participant questions. Okay, so let me just kind of highlight some of these questions. I'm going to go in chronological order, both to make sure I hit all of them, and also because I just think that's the most fair for those who've been waiting. So one question was about whether younger people are having had more reactions to the vaccines than older people. I'm not, so the clinical data, so I'm thinking about the clinical data that the FDA reviewed in those clinical trials. So we're talking like 20 to 30,000 people in both the Moderna and Pfizer trials. I can't remember what it was for J&J. I did not see in their data any dramatic change or difference in the rate with which different age groups were experiencing or reporting, I should say, side effects. Now that's a small number compared to how many people have been vaccinated nationally now. So that being said, I still have not seen data that supports younger people getting more side effects. I think that where this is coming from is people are talking about it, and quote unquote younger people are probably talking about more because they live on social media a little bit more than older people. So I'm wondering if this perspective is partly informed by just where the chatter is coming from and who are you more likely to hear from, like on social media, for example. And I haven't really seen any data for that. If it's true, though, and it's possible that it's true, it could simply just be a result of younger people have more robust immune systems, and all the side effects for these vaccines are signs the immune system has been activated. So it could, like, that would be my go-to answer if that was true. So my two-part answer is I'm not sure if it's true, and if it is, I think it makes sense. That being said, I don't think the increase is such that it should make folks feel more hesitant, because again, it's an increased, I think, rate and not necessarily severity. Like, I haven't really seen anything around that. You didn't ask about children, but I will just briefly say that there are now clinical trials being done to ask children to enroll with parental, assent, obviously, but to see kind of, what's going on with children as well. And so I'm hopeful that in, like, especially small children and teenagers, that we'll get some more data on that in the next coming months. I have a question about egg allergy. So one thing I can say very happily is that none of the, let's see, can I say this? None is always a scary word in science, but I think this is true. So of the three approved and the one that will be soon approved, AstraZeneca, none of them use eggs. There should be no egg component at all in these vaccines. And so I'm not a physician. I want to make sure I'm clear about what my expertise is on, but my understanding is that if you have an egg allergy, it should not be a concern. That being said, anyone with any allergy, when we see allergic reactions to, like, the Pfizer Moderna one, even if we as scientists are like, he has an egg allergy, he's probably not going to have an allergic reaction to the lipids in this because there's no egg involved. You're never 100% sure. So my guess is that your physician might tell you, we'll just make sure we keep an extra eye on you if you take the Pfizer Moderna one, because there's always a small chance that your egg allergy may somehow still be involved here. But I think that I would say talk to your doctor. My assumption is that your doctor will probably say, I think it's okay. But just tell the person who's administering the vaccine, these are your allergies, so that they're aware, because it just might mean we want to put some extra surveillance on you just in case something happens. The J&J vaccine, the AstraZeneca's vaccine, I have not seen any really serious allergic reactions. So, but check with your doctor. There is no egg component in any of these vaccines. So I'm going to say you're probably okay, but always double check. All right, so let's keep going. So let's talk about North Carolina. Okay, last two questions here. If people have had COVID, when should they get vaccinated? Oh, this is a great question. So Tracy, you didn't frame it this way, but I have heard this question brought up with respect to the ethics of getting vaccinated, where people have been like, well, I already have some immunity because I already went through COVID. So and maybe I have a heart condition which makes me eligible for the vaccine, but I've already gotten COVID. Should I get the vaccine or should I wait for other people to come in? And so when this was especially a question that I kept getting back in, like, January and February, and I think all of my colleagues in public health and everyone else was just like, just get vaccinated. What might be special for folks who have had COVID is that you probably only need to get one shot, not two, because your first bout of COVID was your first shot, basically, and this shot, your first real shot, would be actually your booster. The other thing I want to note, though, is that people who've had COVID are definitely more likely to have side effects to the vaccine. So I just recommend that you plan to take a day off after you get vaccinated if you've had COVID already. I also think that where we are today, March 25th, we are now at a stage where we're starting to open it up to, like, firefighters and police people and policemen and women. And so we're now really thinking about who is at risk of exposure, not who is at risk of dying necessarily, right? And so I think we're at a stage now where if you've been waiting because you've been trying to be, doing the good thing and letting other people get in line first, we're at a stage where, like, just get in line and get your vaccine. At least just get one for sure. And getting both of them is still okay, but I'm not sure how the second dose will, if you really need it or not. If anything, actually, I would recommend try going for the J&J vaccine in that case, because it's already a one-dose shot anyway. And that way, the vaccine that may have slightly better efficacy is actually still going to people who have no previous exposure. It's kind of how I think about that question. So I think while I was talking about the egg allergy, Tracy was adding in that she's heard about people with penicillin allergies possibly wanting to wait a little longer at the site. I'm sure that any history of allergy, they're going to say, please wait 30 minutes instead of 15 minutes just to be extra sure, because allergies are weird. We say we have an egg allergy, which sounds very specific, but there's always the danger that there's some other thing that's similar enough that your immune system is like, what the hell is this? And it goes crazy. And so since these are new vaccines, we want to be extra careful. So that I'm not surprised. So I would say, please share your allergies with whoever is giving the vaccine and talk with your doctor about it. And my suspicion is that they'll say, yes, you can get vaccinated, but we'll maybe give you some extra monitoring time just in case, because we have the technology to help you. If you have a serious allergic reaction, you will be okay. I promise. Okay, I think that's all the questions in the chat. I want to, again, invite folks who are here joining me. If you have more questions, pop them in chat, or if you're compelled to speak, please do so. I'm going to be quiet now for a couple of seconds. So what are your other questions about the vaccines? Or vaccine policy? Those are my favorite questions because I'm not an expert, so we're just going to work on it together.
This has been a great session, and it's interesting because from my perspective, you see all of these folks who are on social media getting their first shot or their second shot, and you're like, how are you getting it? And in the beginning, I was definitely of the mindset, like, sort of like Natalie was saying, like, it's not your turn, you're not in line, and how did you do this? And then I guess, I've more of embraced the idea, like, the more people that can get vaccinated, and I don't need an explanation from them, and I don't know what's happening in their lives or, around them. And so, how do we get the most people vaccinated in obviously a fair and equitable fashion? I really want to make sure that like Dr. Ayla Stafford is terrific, and the work that she and her team are doing is just fantastic. And how do we make sure that we're doing in getting folks a priority, but also at the same time, have heard people who, went to the CVS at 2:30 and they had extra shots because of, what you were suggesting about them needing to be, thought out beforehand. And, it's like, good for you for your ingenuity. So.
Yeah. And so I'm just gonna, like you said, my stance right now is good for you. Now get someone else in the same situation, at least one other person, right?
Mm-hmm.
That's all I ask is one person, get them their appointment, get them a shot, get them in the system. And I think that's how I think. I mean, and I'll just say, like, more personally. So my parents all my family lives in Pennsylvania, my immediate family. So like my parents have been waiting forever to get their vaccine, even though like my dad is over 65 and has other things. So like he's been eligible for a while, but just hasn't had an appointment. And then like 2 weeks ago, my brother, who is younger than I am, and his husband became eligible because of their work with a church that they do or whatever. And so they got their shot before my parents, which made me and especially my parents feel a whole certain number of ways. But then finally my parents have gotten their first shot. So like, it's okay. But like, it was like, how is this even a thing? Right. And at the one hand, like, I'm really glad my brother and his husband are getting their shots, right? Because that means that we can maybe have Easter. Well, we're not gonna have Easter together, but like some, Memorial Day together or whatever. But at the same time, it's like, why are you getting it before my parents? That does not make any sense to me, right? With the we were talking about the metropolitan kind of thing being as like, this weird distinction. Like when I think about my parents, like my dad is over 65, my mom is 64. They live together. It's like they should get vaccinated at the same time because it's weird to have this discord in vaccination, but that's kind of where the line was drawn. So, but I think, Biden says that his goal is that every adult will be eligible and able to get a vaccine. Well, we'll say eligible by May. I think we're on track for that. So I think a lot of these like little like weird situations are going to get resolved and just get the vaccine.
That actually announcement kind of changed my moral footing, I think, too, in the sense that and probably in the wrong direction, in the sense that I feel more like what I was saying before. I was much more unctuous when I was seeing people who I didn't necessarily think were eligible. And then all of a sudden, when that announcement came out, I was like, oh, well, this is all in sight. Like it's all kind of within a reasonable time frame.
Yeah.
You know, which is because it's April, you know, next week at this time, it's April, which is kind of crazy. So,
yeah. So I agree. I see Dave is unmuted. I think he wants to jump in. Go ahead.
Well, I took advantage of things just not being organized.
Yeah.
It was the third day that vaccinations were available in this area. I'm in a rural area where there's not many people to begin with. And so I thought, I looked online to see, could I sign up? There wasn't anything that way. So I just drove over and showed up. And,
that's great.
You know, it was before they got their act together. And once I got the first shot, then this, you know, I normally would not have gotten, once they got their act together, then I would not have been eligible. But, you know, because I had the first and I got the second also.
And what I'll say about that is that I'm sure that they thawed a vial for whatever time period that was anyway. And it's not like, the way I think about it is, you know, it's not like you took a shot away from someone, right? Because if someone came there the way that you did, they would continue to give out doses, right? And so I think, yeah, I think that you're good. You know, like it's just everyone needs to get vaccinated.
It was the Wild West at that moment.
I mean, you know, and I'm going to take a very brief pivot here, which might be a little like completely left field for everyone on the call. But again, I'm a professor in higher ed, right? And we know that higher ed has a lot of structural issues and around income and things like that, right? And so every day I'm confronted with my job, which is to teach students, but also as part of a system where I literally see students daily who have various struggles going on. That is, you know, is college really right for them at this point? I don't know. Like, are we just bankrupting these students with more college debt? And I don't have a direct control over the financial aid situation, right? That is not in any way under my control. Yeah, I'm part of the system. And so I have to kind of feel like, well, am I going to take a moral stand and just not teach anymore because the system is not fair? Or am I going to do what I can to participate in whatever makes sense? It's not the same as getting vaccinated, obviously, but I just say that just to say again, I want to really emphasize the system is unfair, right? The system for vaccination is unfair and is not set up in a way that makes sense to me because we didn't invest in planning and all of that last year. And so now we're doing the best that we can. And so the best that we can is, again, just get people vaccinated, get shots in arms, right?
Well,
Susan, I think you want to
there's
jump in.
times that I just say the fair does not arrive until October.
Right. I think, you know, that's not a bad, yeah, that's not a bad way to think about it. Like that. Susan, I see you're itching to contribute. Go ahead.
Yeah, I have been really fortunate to be a volunteer at the different vaccination clinics. So we've done them at the local Sears that went out of business. They've turned into an entire vaccination clinic, which has been great. A lot of the older people are like, I think this is housewares. It's, you know, just people giving shots everywhere. And I clean clipboards and pens and wipe down chairs and feel like I was able to do that. And then they didn't promise us, but they did say if there are vaccines left at the end of the night, then you could be eligible after you've done 2 4-hour shifts. And I got my 2 4-hour shifts. I had my second shot of Moderna, and I'm 2 weeks out from that tomorrow. So
awesome.
I'm kind of in that good vaccination world. But I have volunteered twice this week and then doing it again this weekend. So, you know, each location has a certain allocation that they are given throughout the day, and they are only good for a certain number of hours. So instead of just, you know, showing up as a 52-year-old healthy female, I said, well, I'm going to put time in. And so that has been beneficial. North Carolina has been doing a great job with their vaccinations, especially reaching out to the Hispanic population. In the clinic yesterday, we had 5 interpreters, which was fantastic. We had a sign language interpreter too, which I thought was really great. But then they also have a little machine that you can put in any language for anyone. So that has, I mean, it's truly been an amazing experience to see it all at the same time as being a vaccine volunteer. So it's a great way to be part of the cause, and highly recommend that to other people. Like I said, they don't guarantee that you're going to get a shot, but I would have done it anyway. I mean, it really is nice to be part of this kind of sad historic event.
Right. Well, thank you so much for your service. I think that's amazing. And that sounds like a great system, right? Because obviously you want to use all the shots. So it's like, if we only have 2 left, then, well, we have people here who aren't vaccinated yet. So here you go, right? And that's the way it needs to be, right? Because there is such thing as being too much in the weeds of like trying to track people, like who's next, right? Unless you do like a truly centralized, like we're going to make a day where no one's going to work on this federal holiday or this week or whatever, and we're just going to get people into the convention center and do military style, right? And we could do that, but we didn't do that. And at this point, I don't think we're going to. I'm running up on the end of my time. I want to know that this session ends formally 2 minutes ago. So if you have other places to go, please do that. I don't have other places to go, so I'm going to stick around a little bit longer until at least my hosts have to literally leave. I do want to just briefly talk about Emily's last question here about vaccination cards. And the idea, like, are we going to be asked to have basically a vaccine passport? This is a very controversial topic. It has privacy issues, tracking issues, in other countries, they've even, been linking this to an app that you have to show the authorities that, yes, I'm allowed to do whatever. And so I feel a whole bunch of different ways about it. Your question was whether we think it's going to happen. That's hard for me to answer. I would be surprised if the federal level we do that. I don't know how that works jurisdiction-wise with states. There could be a case where I guess states can regulate who goes in and out. So I would say formally it's a possible. Whether it's probable is a different question, and I really don't know. This is a little bit of new territory, I think, for us as a country thinking about this question in this particular context. What I would recommend people is to take a photo of your vaccine card and keep your vaccine card in a safe space at home for now, unless you know for a fact some place is actually asking you for your vaccine card physically. But for now, I would definitely hold on to it. I personally hope that they don't really push towards this vaccine passport system, because I think there's a lot of First Amendment issues and other personal freedoms issues associated with that. But just in case, I would just take a photo and keep it safe for now. Yes, right. So thank you, Tracy, because I think I interpret Emily's question as kind of like legal spaces of like where you can go and things like that. But there are also, I'm sure, going to be situations where in places where you can opt in, like going to a Miami Heat game, right? Where they are going to sort of start doing that, and they may be asking for that. And that's a whole area of legal questions I'm gonna have to ask my husband about, because he's a lawyer. But that's an interesting question. I anticipate, we're already seeing that now based on your example, Tracy, and I anticipate that's going to continue to be the case, where people are going to be trying to create vaccine safe zones. I feel 2 ways about it. One, from a public health standpoint, on the one hand, that feels problematic, because we want to really set the stage that we should all be doing our best to mitigate as much as possible until the rates are really, really low. At the same time, I think that situations like that may hopefully further incentivize and inspire people to get vaccinated. So also from a public health standpoint, it may be something that could maybe get some people who are not sure, oh, I want to see that, and I want to be able to do that thing. So fine, I guess I'll get the vaccine, right? There will be people who are like, I don't really know if I want to get the vaccine, and now I feel this is unfair. So there's going to be debate about it, and we'll see what private businesses will do. I hope government-wise we don't do that. I think that would be a really big thing, but private businesses are going to try to do all sorts of fun stuff like that, and I'm curious to see what happens. So maybe in June or May when I do this again, because I'm doing this every month, we'll see more examples and we'll talk about that. So great. Okay. It's 4:36. I want, again, if you need to go, thank you for your participation. I will stay here for another couple minutes unless Emily tells me we really have to go. And I will be here again another month or so. So hopefully we'll see you again next month, and tell your friends if this was useful and interesting that this is a space for them to ask questions. And thank you to the Science Center for hosting me.
Yeah, thank you so much. I will have to run in a few minutes, so if there are any questions, please present them in the next. The next minute.
I forgot to put this earlier, but my email address is here. My name is Jason. Feel free to email me any further questions, and watch the Venture Cafe space for my next opportunity. Yeah, thanks for your participation.
And thank you so much. This is a really great, another really awesome conversation. So thank you so much for bringing that here.
So your doctorate, is it
Yes.
MD, public health, epidemiology?
I'm a virologist.
There we go.
So my expertise is really in the vaccine design, understanding a little bit of the immunology that's going on, understanding the manufacturing a little bit. And I've learned a lot from my public health colleagues. And I try to be really careful about not giving real medical advice. Say, from a science standpoint, this is my thought, but please check with your doctor who is actually qualified to give you medical advice. Also because everyone is a little bit different, right? Their specific medical situation is different, but
right.
So. Yeah,
the virologists are the ones teaching the MDs.
Yes, that is true. I mean, it's a lot. They have to know a lot. Like, it's very easy for me to say I'm an expert on this very specific virus. How do you not know this one very esoteric detail? Whereas they have to keep track of hundreds of different diseases. So yes, we do teach them, but
And most MDs only have 2 hours worth of training on immunology.
Yeah, and which is immunology is really complicated.
Yeah,
really complicated.
Yeah.
So,
thank you.
Hopefully I'll see you next month.
Take care.
So.
All right. I think with that, I think I'm going to close this out here. But again, thank you so much. We really appreciate you bring this space here. So
great. Looking forward to next time. Thank you so much, Emily. You've been a